Hey, I'm Dr. Hannah. I am a physician with type 1 diabetes, and today we're going to talk about the Eversense continuous glucose monitor that is the only implantable continuous glucose monitor on the market. The way that this works is it's a small piece that is inserted usually under the skin in the upper arm, and it can be worn for up to 6 months. This is a great option for somebody who perhaps isn't using an insulin pump that connects to a continuous glucose monitor and they're having trouble with irritation from the glue. Once the implantable glucose monitor is under the skin, then there is a transmitter that's worn on top, magnets over, and that needs to be charged every night. You can wear it for 6 months, but for the first 21 days, they do recommend calibrating it twice per day to improve accuracy of the readings. This is a continuous glucose monitor that doesn't have as frequent insurance coverage as the Dexcom and the Freestyle Libre, but what I'm hearing is that we're seeing it covered a little bit more than it was when it originally came out. The procedure to put the Eversense glucose monitor in the system is just a really short, simple in-office procedure. So it's not a big surgical event. It's something that can be done by a trained healthcare provider in a general outpatient clinic during an office visit. It takes about 5 minutes plus or minus, and then you come back 6 months later to replace that again. What's great is that transmitter that sticks up on top of the CGM that's implanted can be taken off, which is great for showering, and often people will charge it while they're showering. The accuracy of this CGM is compatible with that of Dexcom G7 or the Libre 3 sensor, and we're not seeing it to be significantly more accurate or less accurate than the others on the market. The other thing that I think is interesting about it and quite different than the other CGMs is that it can actually vibrate on your body to alert you for a high or a low. So if you're not around your phone, if you're not around your phone or your phone is on silent, this will actually vibrate on your body to alert you. And I think that's great, especially for nighttime lows. I can see how that would be a benefit if it were to wake you up when sometimes a sound stimulus wouldn't. Eversense is FDA approved for people with both type 1 and type 2 diabetes. If you have any other general questions, feel free to pop those below. This is a sensor that's been on the market for a little while that honestly I didn't learn about until later on, just because of the frequency of use. I didn't know anybody that was using it. I think it's helpful to know about as we are learning about diabetes technology. Options are important. And so knowing that there's an option of a sensor that will vibrate on your body or a sensor that may reduce the irritation that you're getting from the glues and the adhesives from the other sensors is nice to know. If you haven't already, I'd love for you to like and subscribe to my channel if you're interested. I provide content for people with type 1 diabetes about how to live a happy, healthy life. And I just launched my first type 1 diabetes mindset course. And this course is designed to help with the mental, emotional stress impact of diabetes on life. It's a 6-week self-paced online course that's pre-recorded, so you can listen to it whenever you'd like. It's completely led by me, and it has a lot of activities that allow us to evaluate our life with type 1 diabetes and create a relationship with it that feels better. So if you're interested, that will be in the description below. Thanks so much for sticking to the end, and I hope to see you next time.